Complications from varicose veins include phlebitis, where the vein becomes inflamed. In more serious cases, you can get bleeding or ulceration.
So chronic venous insufficiency is a lack of blood flow back. So you can have varicose veins, you can have all sorts of problems with the lower extremity, like the ankles, retaining fluid, altered pigmentation. So you see this a lot with diabetics where the lower leg has this darker color.
For varicose veins, it's usually an inherited factor, but what can compound it even more is if the person's constipated, that puts pressure on the legs. If a person's carrying too much weight, it puts more pressure on the legs.
Complications from varicose veins include phlebitis, where the vein becomes inflamed. In more serious cases, you can get bleeding or ulceration. Most of these complications, however, are not life-threatening. So I recommend for patients who are hesitant to undergo treatment to still see a vascular surgeon. We have multiple conservative treatments that can help alleviate your symptoms and potentially avoid any invasive treatments.
The number one best remedy for vein problems in your lower legs is this red vine leaf extract. And I found this data in a patent where they had all this additional research. And of course, this patent was probably based on the huge study they did. Now, the amount of red vine leaf extract that they used was between 360 to 720 milligrams per day for 12 weeks. And the results were significant. Red vine leaf is also good for an enlarged liver, an enlarged spleen, swelling in your legs, hemorrhoids, bruising, bleeding, nasal congestion, capillary thickness, and it's a great anti-inflammatory. And it also helps to balance the permeability within your capillaries. And the other thing I would recommend is to start doing the rebound exercise, simply because that's going to start increasing lymph flow and help push some of this fluid through your veins. And of course, I would definitely recommend doing walking on a regular basis. You want to keep active. You do not want to do a lot of sitting. You don't want to do a lot of standing.
For varicose veins, it's usually an inherited factor, but what can compound it even more is if the person's constipated, that puts pressure on the legs. If a person's carrying too much weight, it puts more pressure on the legs. It's very important to massage the venous system. You see, the arterial system comes away from the heart, the venous system comes back to the heart. And our second heart that stimulates our venous system are our calf muscles. And so any exercise that really uses that calf muscle is excellent for varicose veins. So that's rebounding, exercise bike, swimming, but that person should not do running.